Good morning and welcome back to Morning Express. It is time for your health, and this morning we focus on thyroid cancer. Joining me in studio is Dr. Eliud Njuguna, who's the head of oncology unit at the Nairobi Hospital. Thank you, Dr. Ari, for being with us this morning. So let's get right to it. Thyroid cancer. Talk to us about this cancer. What is it?
I think basically before we even zero in on thyroid cancer,
yes,
it would be prudent to say that cancer is becoming a major health problem. It's a major issue, a big challenge and strain to the health services. Now, commonly we've been talking about the common cancers. I'm sure in the month of October we were all flooded with information about breast cancer. And time and again we've heard about prostate cancer and carcinoma of the uterine cervix.
What is that? Perhaps break it down for us.
Carcinoma of the uterine cervix is cancer that arises from the neck of the womb, the entrance to the womb. It's called the cervix. So these happen to be the common cancers, but there has been a trend to forget some cancers that do happen but are rare. And one of these is the thyroid cancer.
Okay.
Now, the thyroid is an organ that is on the front part of the neck. I am sure you've seen people with goiter, an enlargement on the front part of the neck. That enlargement is usually the thyroid gland that is enlarged.
Okay.
So functionally, the thyroid does secrete some hormones that do help in metabolism. And like every other organ in the body, it is amenable to getting cancer. So when it gets cancer, that's what we call thyroid cancer.
Okay.
Yeah.
Is it common? Is it a common type of cancer?
It is not one of our top 10, but it's not rare. It's common in ladies and men. No clear explanation as to why. And it is also fairly common among the elderly as opposed to the young people. And basically, thyroid diseases span the whole age spectrum. But the cancer itself is more among the elderly. And in most cases, you cannot pinpoint at an actual cause.
Yeah, because I was going to go to that, on whether it is clear what is the malfunctioning that causes it.
No. But there are a few associated factors. Talked of age, talked of sex being more common in females, and exposure to ionizing radiation.
What would expose? What would? Yeah.
Yes, the exposure is usually medical, unfortunately.
Okay. So somebody who's gone through what process, for example, what medical process would be more prone to getting is?
Ionizing radiation in medicine is used basically for diagnosis and treatment. But it is in the spectrum of the people who get treatment, slightly higher doses of radiation to the neck, that later in life develop thyroid cancer that is linked to that radiation. A good example is children treated for lymphomas in childhood. In their adulthood, fourth, fifth decade of life, they have an increased risk and incidence of thyroid cancer than the common population.
Okay.
Yeah.
So, so the cause not clear, not known. In terms of manifestation, you've talked about like the likes of what happens in cases of goiter. So, is it an enlargement that one will witness, or is there any pain as well, or are there any other manifestations that one would look out for?
Yes, unfortunately, like in most other cancers, you may have the disease and no symptoms at all. And usually by the time you start getting symptoms, it means the tumor has grown to cause pressure to the surrounding organs, to the neighboring tissues. So most of the time it will be there, painless, not causing any symptoms. However, on achieving a certain size, there may be asymmetry on the neck, because we've said that anatomically is placed on the front of the neck, one lobe on either side and one lobe on the other side. But when you get cancer, it doesn't occur uniformly. It's likely in one lobe, and even when it's in both lobes, it does not grow at the same rate. So there is asymmetry. Rarely do you get pain, but you could get pain when there's pressure on the surrounding tissue. You could get pressure on the airway. That means that you'll have issues breathing. And you could also get pressure on the nerves that can cause change in voice. But you can also get, just like the way you get injured on the leg and you get nodes on the groin, injured in the hand, you get nodes in the axilla, you can also get enlarged nodes as a first sign of thyroid cancer.
Okay. Yeah. In cases of breast cancer, it is advised for early catching of it is to keep checking oneself. Is there any way, because you say for this, by the time you're getting these symptoms, it could be very late in the day. What then can one do to perhaps ensure that they're checking or they're aware of their status? Or do they have to undergo a medical examination?
Okay. There are two scenarios. There is a population at risk and the normal population. For the population at risk, people who have been exposed to radiation, or there's a very strong family history of goiter or thyroid cancer itself,
right,
then they should be checked every 1 to 2 years by a medical professional. For the population with no known risk factors, then there is no clear reason to subject them to thyroid checks. However, everybody as an individual is responsible for their health. And the easiest way to know when things are going wrong is just when you wake up or when you're doing your things and you feel there's something different, then that different thing should be given attention. Okay. So if you feel there's any change in your neck or anywhere in your body, then you seek attention. And one of the things that should be looked at is thyroid. So if you're doing a whole medical examination, the thyroid should not be excluded.
Okay. So once one is diagnosed with this cancer, what's the treatment?
Now, as I have said that the thyroid gland produces hormones. So the first step is to establish, on top of there being cancer, how is the functionality? Is it still doing what it should to the body? Is it giving adequate amounts of hormones, or is the remnant of the normal thyroid giving the adequate
that's
hormones?
That's scientific.
So yes, so if it is not, then of course you need to supplement the thyroid hormones. Secondly, the mainstay of treatment is surgical.
What would that supplementing require? Is it surgery? Is it medication?
No, medication.
Okay.
Medication. You get a tablet that contains a hormone, and
all right,
it kind of covers for the deficiency.
Yes.
If the tumor is amenable to surgery, by that I mean if it is not too large and attached to other organs, then surgery is a treatment of choice. And this means that surgeon will go in, separate the thyroid partially or in full from the normal tissues and remove it out of the body. If it is not possible, if it is too advanced and attached to the other organs, then we go straight to other modalities, which include radiotherapy and chemotherapy, and most important, a form of targeted therapy called radioiodine therapy. Now, back to the basics. There are several types of thyroid cancer, and there is one that we call differentiated thyroid cancer, and this resembles the normal thyroid cells. The cancer cells resemble the normal thyroid cells even in function, and physiologically the thyroid uses iodine to make the hormones. So this treatment then targets the same phenomenon. You administer to the patient iodine that is radioactive, and it is preferentially absorbed by the thyroid and not other body tissues. So it does deliver radioactivity from within the thyroid, and thereby killing the cancer cells from within. And this is, as I said, a targeted therapy because basically the iodine is preferentially absorbed in the thyroid gland or by thyroid tissue. Now, this treatment is, however, tricky in that you have given the patient something that is radioactive. So this patient may be an environmental hazard in that they will be radiating or emitting radiation from within. So they have to be isolated from the rest of the population.
Wow.
So usually they would be put in isolation until the radioactivity falls to environmental friendly levels. And this takes usually 5 to 7 days.
Okay.
Yeah.
So of the three, you've mentioned there are 3 types of this thyroid cancer. Which is the most dangerous?
I think when looking at, the answer probably would say the most aggressive rather than dangerous.
Yes.
We look at 2 aspects. One is which by nature is aggressive, is more virulent, and that is probably the anaplastic type, the undifferentiated type, because it grows faster, spreads faster.
Right.
But then we also look at another aspect that will also give an answer to that question. What are the options of treatment for each? For the differentiated type, we say surgery is there and radioactive iodine is there. It's a good a very good modality of treatment. But for the anaplastic type, you are limited because it does not take up the iodine, which means that you have very few ammunition to fight it because you're limited to surgery, radiotherapy, and chemotherapy.
Okay, so it's not prevalent in Kenya. How many cases perhaps do we see in terms of when in comparison with others that we see and hear about more? Thyroid cancer is, you said earlier on, in terms of the cases, there are fewer.
It is fewer. I said it may not be our top 10, among our top 10, but we still see significant figures, probably between 100 and 200 in the public institutions. Basically, what is in record. But as you know, our data capture is not complete.
Yeah.
Yes, but the thing is that we are saying we should start also focusing on the rare tumors. Remember medical statistics when we say that it might be 1 in 10,000. If you happen to be that one, for you it's a totality, isn't it? It doesn't matter than the other that among 10,000, 9,999 did not get it.
Right.
So we're saying it, rare as it is, it should also be given adequate attention. So all the rare cancers should also be addressed and treated, because on paper the statistics is low, but when it hits for that person is a totality. Now the other thing is that there are areas in Kenya that were deficient of iodine, and we have people who had multiple goiters, and their pockets known to have that. We should not be alarmist in, to the extent of making them think that once they have a goiter, they have cancer. No, most of them are still benign. As pertains to cancer, they may be innocent. However, they still need, anybody with goiter needs to seek attention.
Okay, yeah. So I assume at Nairobi Hospital you have the facilities to be able to deal and handle this and help those who may come seek treatment in terms of going through their treatment. But in larger scale, do you have knowledge of whether, especially around the country and most of the grassroots, do we have facilities that if somebody is suffering from this, they would be able to get that assistance? Or is it a challenge for those kind of patients?
I think then we can also look at it stepwise. For the prevention of goiter, we all have capacity, even at the individual level.
Okay.
And that's why there is a requirement for all the salt to be iodized. Iodine is added to the salt to prevent that. Now, early detection and diagnosis. Most hospitals at all levels have capacity for early detection and diagnosis. Most from the district and provincial hospitals upwards, and most faith-based institutions, and basically all private hospitals.
Right.
Now, when it comes to offering surgery again, most provincial hospitals and above will do that. But when it comes to offering radioiodine therapy, it's a major limitation. The service is only in the private sector. It's only available right now at Nairobi Hospital. In the public sector, it's only available at Kenyatta Hospital. That tells you something. These are two neighboring institutions close to each other, and that tells you that somebody from all corners of the country have to congregate around those two institutions. Yes, but and by the way, we do also get quite a number of patients from neighboring countries coming to seek the same service.
Before we wind up, finally, what is it important for everybody to know? You've talked about iodized salts being one of those preventative measures that can be put in place, but what is the take-home for people watching this morning?
I think the take-home message should be for everybody to know themselves and who know when there is a change in their body, seek prompt and appropriate medical attention, and hopefully you seek that attention at a level of care that is also able to offer it to you, because at times you have people who present in health centers and are treated for all sorts of things, before the diagnosis is made, and that actually plays a role in the in delaying diagnosis and progression of disease. So that what everybody should be is conscious of their health, seek appropriate attention, and in the unfortunate event that they are diagnosed with cancer, know where to go for the treatment.
Okay, I understand there's a caller who, before we go, will talk to us. Susan.
Yes.
Thanks for calling. Go ahead with your question.
Should I ask? Hello.
Susan, we're listening.
May I ask?
Yes, go ahead.
Okay, this is Susan. Last year I had a certain lump. Last year I had a certain lump in my.
Yes, Susan, please,
Hello?
go ahead with your question. We can hear you. Just speak, and we're listening.
And then maybe my question is controversial because I was asking about the breast cancer.
Sorry?
I was asking about the cancer, so I don't know if my question is controversial.
Oh, sorry, we didn't get you. You're asking about a lump in your breast?
Should I continue?
Sorry?
Hello?
Okay, Susan, just go ahead and ask your question, and the doctor, if he can answer, he will.
Okay. Last year I had a lump in my breast, my left breast. So I was pregnant. Then when I went to the hospital, I was told that I should give birth first, then I start my medication. So after giving birth, I went home. Then I stayed there for some time, but this lump was still growing. Since I was breastfeeding, it was so swollen. So this year, when the cancer awareness was announced, I went, and then it was a. Hello.
Yes, we hear you.
Okay, and then it was. I saw the doctor saw me. Then I was referred to a certain hospital.
So what's your concern, Susan? What's the question?
Hello?
What's the question, Susan?
Okay, let me cut it short. Could you please give me the phone number of the doctor so that I can go to Nairobi Hospital direct to them?
Okay, perhaps he can direct on where
Yes,
can
I
find
think
you.
it's simple. But
Pardon?
I think, Susan, you
All right,
raised two
thank you.
issues.
Let's,
One of the
get
issues
Susan
you've
on the
raised is about a breast lump.
Yes.
And every breast lump should get should get attention. Most breast lumps are benign, but if it's progressively enlarging, it's highly suspicious of malignancy or cancer in simple terms. And most cancers are also more aggressive in pregnancy. And if you are told to wait for delivery, then it meant that you should have gone back without having to wait for breastfeeding, because breastfeeding can be stopped and you get treatment. However, if there are issues, you are welcome to the Nairobi Hospital Cancer Center, and we will advise you further or manage the situation appropriately.
All right, Eliud Njuguna, Doctor, Head of Oncology at the Oncology Unit at the Nairobi Hospital, with us this morning on thyroid cancer and your health. Thank you so much, Dr. for being with us, and thank you for watching the show today. We end it there on behalf of all that made the show possible. It's always a pleasure to be part of your morning, and thank you for investing your time with us. We'll see you tomorrow.